do, you just remember a mnemonic, and the mnemonic is what? BASU. Okay, BASU is B. B is blood culture, A is agglutination, S is stool culture, and U is urine culture. Okay, U is urine culture. The blood, and in which particular time period you do that? The blood culture is done in the first week. Okay, then you have the agglutination, that is in the second week. Then you have the stool culture in the third, and in the fourth you can go for urine culture or urine ELISA. Okay, so remember that particular one. So first of all, if we talk about the blood culture stuff, okay, if we talk about the blood culture stuff, guys, you know that blood culture we already have talked about that when you take the blood, the ratio should be 1:5. Means if you take 10 ml of blood, 50 ml of culture fluid, and here which culture fluid is estimated up, guys? That is the bile broth, because it loves to grow in bile. Or you can use glucose broth also, and even you can use BHI broth also for this particular one all. Fine. And there are automated blood culture systems, BACTEC and BACT-alert, that can be used to culture this particular organism from the blood. Okay. Regarding the stool culture, if somebody asks up in the 3rd and 4th weeks of illness, stool culture I have told up now. So in that you should know certain culture media names. Like if somebody asks you that what is the transport media for this, and the transport media for this particular one is what, guys? Sachs, Burford, glycerol saline. And what is the sample? Stool and urine. Okay. And what is the enrichment media? So you guys, you should know what is enrichment. Enrichment is a liquid media which is used to enrich these particular organisms. So enrichment media is selenite F broth. Okay, which is the enrichment media? Selenite F broth. And if somebody asks you the selective medias, at least 3 names you should know. One is DCA, deoxycholate agar. One is XLD, xylose lysine deoxycholate, and one is Wilson and Blair. And the best media is which one, guys? Wilson and Blair. Okay, Wilson and Blair. And for the urine culture, you can use even the MacConkey agar also. Okay, so you can see that these particular colonies are there of the Salmonella typhi on the various medias like deoxycholate agar. Okay, over the XLD, this type of colonies they come, and obviously the jet black colonies, they are being observed on which particular media? The best selective media. The best selective media is which one, guys? The best selective media is Wilson and Blair. Okay, so these are the various investigations you will do by the mnemonic BASU. You can remember the weeks also. And there was a question also in one of the exams that on the 3rd day of the fever, which investigation you will do. So guys, on the 3rd day of the fever, the best is to go for the blood culture. And if in the option it is being written as bone marrow, can we use? Yes, we can, and bone marrow is better than the blood culture. But the problem is bone marrow is not easy to drive as compared to the blood. So obviously what we use actually the blood, not the bone marrow. But if it is given in the options, bone marrow culture is better than the blood culture for sure. Okay, and you